vamos dar disso, esta mesa redonda. E, inicialmente, quero agradecer à Comissão Executiva pelo convite a mim formulado, que eu também sou octogenário. E eu gosto muito de ser recebido nessas coisas, porque eu estou vivendo a situação. A mesa, então, será composta pelo moderador Zé Luiz Nascimento Silva e Fúvio Rara. O debatedor convidado é Leonardo Lucas e o coordenador Pedro Henrique Nunes. Eu vou chamar inicialmente o Dr. Mariano Ferreira, da Argentina, para falar sobre tratamento endovascular do aneurisma da artéria poplítea.
Thank you again for this opportunity. As you know, popliteal aneurysma are the most common peripheral aneurysms, probably almost 3% of all aneurysms. Usually it's asymptomatic, but almost 40% became symptomatic after 3 to 5 years. Positive predictors of complications are the size, the partial thrombosis, and also the poor runoff. The gold standard continues to be the FEMPO bypass with proximal and distal ligation using the great Safen's vein with a 5-year permeability rate with more of 70%, mortality less than 2%, with some associated complications like amputations, occlusions, infections, or hematomas. But on the other hand, the endovascular treatment of these aneurysms is a promising procedure. And in a select group of patients, we start using the Viaban for treating this type of popliteal aneurysms. This Viaban was described to have a thromboresistance related to this bioactive surface. And this bioactive surface continued to be active for more than 1 year. One of its better characteristics of the Viaban is the resistance to kinking and also the resistance to longitudinal compression. So our experience include 22 procedures. All were done under local anesthesia, ipsilateral open SFA approach, and we deploy the endograph after making an angiogram in limb extension and flexion. Some technical aspects include proximal and distal 2 centimeters anchor is zone, avoid anchor or overlap in the flexion area, no oversize, avoid or minimize the overlapping, the need for more than 1 vessel runoff, and also the deployment should be done from distal to proximal. Those are the pre- and post-operative angiograms where we can see complete exclusion of the popliteal aneurysms. Results, 22 patients, 21 men. The stengram used in all patients was the Viaban. The average length of hospital stay was 2 days. None of the patients were lost to follow-up. No stent occluded, no stent fracture, no type 1 endoleak, 2 type 2 endoleaks, with an overall survivor at 4 years of 74%. Here we can see in this table the worldwide experience with Viaban, with 301 patients with a follow-up between 7 to 54 months, with a primary patency rate of more than 80%, with almost 100% of limb salvage. Another table with also 5-year follow-up with more than primary patency rate of 70%. This paper from the NYU with a 5-year patency rate of more than 80%. And again, the number of vessel runoff is a predictor of technical failure, as you can see in this table. So in conclusion, these results support elective endovascular popliteal artery repair in anatomically suitable patients. Poor distal runoff predict graft failure, and a prospective randomized multicenter study to justify this approach in the immersion setting is warranted. Thank you very much.